Hello, my name is Bill Kabasenche. I am a professor of philosophy at Washington State University and also the ethics education director for the Elson Floyd College of Medicine at Washington State as well. And I'm looking forward to being with you in September at your annual retreat. As a philosophy professor who teaches and writes about biomedical ethics, I think an awful lot about the relationship between medicine and ethics. And so that's what I'll be presenting on when I visit with you all in September. I think a lot about the relationship between the two and how they go together or don't go together. It's not uncommon for people to think of medicine and ethics together in the context of controversy. There are lots of areas of medicine where there's controversy and lots of disagreement about what is the best or the right thing to do. And so I'll actually start my talk by discussing a bit some of the ways that I think that there's a natural partnership actually between ethics and medicine. One of my favorite things to do is to ask new medical students whether they think that a physician can be effective as a physician without also being ethical. And I try to make the case, and I'll do this with you all as well, that at least with respect to some areas of ethics, there's a close relationship between ethics and effectiveness. As in, if you're doing a good job as a doctor in the sense of you're being effective as a physician, that would also require you to be doing a good job in the sense of being ethical as well. So we'll talk a bit about that and talk about the ways that I think ethics and medicine are aligned. But to be clear, this is not all of ethics. There definitely are some areas where there's pretty intense ethical controversy and lots of disagreement about what is the best thing to do or what is the right thing to do. And so I also want to spend some time in the talk considering with you some ways to approach disagreement in medicine and other areas, and some of the skills that you can use to navigate some of that disagreement. Now, to be very clear, I'm not going to come and give all the answers to all the hard questions. In fact, if I said I was going to do that, you would understandably be, I think, quite suspicious. So what I'll propose is some ways to approach disagreement that don't presume that I have the answers to the questions, but that suggest that maybe working with others, and particularly with groups of people from a diverse set of perspectives, we can work together towards finding what I think are helpful ways forward, if not resolutions for all times and all places to some of these questions. So I want to talk with you a bit about how to navigate some of that moral disagreement and some skills that you can use to work through those disagreements with patients, with colleagues, with professional organizations, maybe disagreements with the law and what it expects of you. And then finally, I'm curious to hear from you. I'm looking forward to taking some time to talk about some of the ethical issues that come up in the area of kidney care medicine that you think about on a regular basis, and thinking together with you about how you can approach some of those things. So again, I look forward to seeing you in September.